Welcome to this special interview on the personal side of medicine, offering a unique perspective on the values and principles that shape the person who wears the white coat. I'm joined today with a distinguished doctor who's dedicated his life to healing. Thank you so much, Dr. Daneshvar.
Thanks for having me.
Us.
Appreciate it.
So what inspired you to go into medicine and then urology?
Very good question. So I'm actually from a family of doctors. So growing up, what inspired me were the stories that my father told us from his experience in the hospital. My siblings ended up being physicians, uncles, cousins, so it kind of became the family practice. Urology specifically, I'm the first one in the family. I think urology is a great field because it brings together both medicine and surgery. So I can medically manage a patient or surgically manage them. And most patients that come to urologists remain patients for the duration of their lives. So I think it creates a very good bond between the physician and the patient.
So what hobbies or interests do you pursue that influence the work you do?
I'm a big sports buff. I'm from Los Angeles originally, big Laker fan, born and raised in the era of Kobe Bryant. I think it influences my practice, and medicine is truly a team sport. And when I see players on the court playing well together, I constantly refer to captains of the team or different players in the operating room with the residents. And I think everyone needs to work together, including anesthesia, to better care for patients.
What personal experiences have you gained in your work that have influenced your worldview or personal value?
Well, I think my personal experiences came partly in my training at the National Cancer Institute, an institution where patients are treated without insurance, without any payment. And that experience really showed me what medicine can potentially be like, and truly where at an institution where physicians are mostly working to better their patients' lives. And I think that experience is really what I try to emulate every day in my practice. Obviously a different situation, but I think it's important to constantly think about the patient and how to better their lives.
So what is most fulfilling and motivating about the work you do?
I think it's either treating patients that come in with pain or with cancer, for example, and seeing what their outcomes are like, and seeing them progress after surgery or management and get better, seeing their families, support them throughout the process, and being able to really hold their hand throughout the journey and help them get through it.
Well, so how do you cultivate those important skills like effective communication and building of trust between your patients and their families?
Well, I think it takes time, and it takes time explaining things to patients, being fully transparent. I really pride myself on giving all the options to my patients, whether it be surgery, radiation, or other managements. I think it's important that they hear the whole picture and not just that I'm a surgeon that wants to constantly cut. I think that the most important thing that builds trust with patients and their families is that there are options to management, and that I'm very transparent about giving them all those options.
Well, so what are the most important technical or even personal skills for a successful urologist to possess?
Well, I think that involves years of training. It starts, I always joke with people, it starts by playing video games as a child, to being crafty with your hands, to being creative and constantly working on the craft. A surgeon's not made in one day. It takes a very long time to become quote unquote good at surgery or good at treating patients. And I believe it takes a big investment, and I'm constantly investing in that as well.
How do you address patients' hesitations or concerns about seeking your care, especially for urologic oncology?
Sure. I think I spend more time with them. I walk through the anatomy. I show them their images. I explain things in layman terms where they can understand better what they're going through, or what I plan to do for their surgery in order to help them understand it. And I always tell them to bring family members so I can explain it with family. And I think it's very important to have support before or after surgery as well.
Well, so how are you involved with or preparing for the changes that are coming to urology?
Yeah. So that's the beauty of being in the academic environment at a university is we're constantly learning, constantly going to new conferences, different conferences, be it general urology, urologic oncology, learning about the upcoming trials, the new medications. When I started my practice or my training years back, there were only a few drugs, for example, for metastatic prostate cancer. Now we have many more. I think that it's constantly evolving, and we have to keep up as physicians with these changes and actually have these changes translate in our practices with our patients.
Your dedication to your patients and profession is truly inspiring. We wish you all the best in your continued efforts to make a positive impact on this world.
Thank you so much. I appreciate it.
Let us all take a moment to reflect on the values and principles that shape our own lives and the impact we can have on the world around us. Until next time, this has been a special interview on the personal side of medicine.